Well, everyone, welcome to the South Pole Climate Chatter series. It's a series of online conversations that we have with interesting people. And today we're delighted to have Dr. Sam Myers with us. He is not only a principal scientist, a research scientist at the T.H. Chan School of Public Health at Harvard, but he's also the director of Planetary Health, the Planetary Health Alliance. And before we start with this 20-minute conversation with Sam Myers, followed by a 20-minute Q&A, I just wanted to go through a couple of housekeeping rules. So you are all on mute, just so that there won't be any distractions. This means that we're open to questions and comments, and any questions that you have for our Q&A, please submit them in the question box, which you'll see on your Zoom screen. So we're going to do 20 minutes of conversation with Sam, and then we're going to do 20 minutes of Q&A. And if we find that we cannot exhaustively talk about this subject today and now, then we might have the opportunity to do a follow-up conversation with Sam at a later time, I hope. So Sam, welcome to this Climate Chatter event. And first of all, I think our audience, some of them might know exactly what planetary health is, but for some it might be a first introduction to this. So can you tell us, please, what is planetary health and where does it come from? Why does it seem to be on everyone's mind today?
Sure. Well, thank you for having me, and thank you everybody for joining us, and good morning or good afternoon if you're in Europe. Yeah, planetary health is a very, very new interdisciplinary field that really sort of came into the public awareness only in the last 5 years or so, and it's squarely focused on understanding the human health impacts of our global sort of disruption and transformation of most of our natural systems. So how human beings are changing natural systems and what that means for our own health.
Excellent, excellent. And why is it on everyone's mind right now, do you think?
Well, I think it's really sort of an extraordinary and even unique moment that we're in human history right now, and it's hard to overstate the pace or the scale at which human beings are now transforming not just the climate system, but all of our natural systems. You know, some people have called it the Great Acceleration. If you look at curves of sort of human impacts across, you know, any of our natural systems, from deforestation to biodiversity loss to adding carbon dioxide to the atmosphere to production of, you know, paper and plastics, you know, really across the board, what you see are these relatively flat curves until around 1900, with a gentle sort of steepening up until around 1950, and then this nearly sort of exponential increase in the net sort of ecological footprint of humanity. And what's happening is that you know, we now use 40% of the terrestrial land surface to produce our food, and have converted 40% of land use for croplands and pasture. We use half the accessible fresh water on the planet, mostly to irrigate our crops. We fish 90% of monitored fisheries at or beyond maximum sustainable limits. We've dammed over half the world's rivers. We've cut down half the world's forests. So the scale of our impacts on natural systems is enormous. And the core premise of planetary health is that the scale of the human enterprise now exceeds our planet's capacities to either absorb our wastes or to produce the resources that we're using sustainably. And as a result, we're changing the climate system, we're driving the 6th mass extinction of biodiversity, we're transforming land use, we have problems with global pollution of air, water, and soil, we're changing biogeochemical cycles, we're driving scarcity of resources like fresh water and arable land, and that all of those large-scale environmental changes are interacting with each other in complex ways to alter the fundamental conditions for human health and well-being. You know, the quality of air we breathe, the quality and quantity of food that we can produce, the quality of water that we have access to, exposure to infectious diseases as we're seeing today, exposure to natural hazards and extreme events. And so ultimately, those fundamental changes affect just about every single dimension of human health. And so planetary health is about understanding how that's taking place, what the health threats are, and how we think about that effect of our transformation of natural systems.
And you talk about the great transformation. Can you tell us a little bit about the research that you've done? You yourself, you're a researcher at Harvard. What does this planetary health science tell us?
Well, I mean, in a lot of ways, the science is the beating heart of the field. So over the last, 10 or 15 years, there's really been a rapid growth in the science and in our understanding of some of the ways that changing natural systems affects human health. And so my research is just one example of that. We've done research looking at the impact of rising concentrations of carbon dioxide in the atmosphere and shown that the elevated carbon dioxide is actually making our food less nutritious. And in fact, we're seeing when we grow crops at elevated CO2 at levels we expect to reach by the middle of this century, that we lose really important nutrients like iron and zinc and protein in staple food crops like rice and wheat and soybeans. And we've done a series of modeling studies subsequently showing that the impacts of those nutrient changes could be between 150 and 200 million people in the world becoming at risk for insufficient intake of those nutrients, in addition to around 1 billion people who already experience deficiencies, whose deficiencies would be made worse. We do research on global pollinator declines, the loss of bees and other pollinating insects, and have shown that somewhere around 500,000 excess deaths a year are resulting from just not having enough pollinators left in the world to increase the yield of pollinator-dependent crops, which turn out not only to provide important nutrients for us, but also to protect us from non-communicable diseases like heart disease and stroke and certain cancers and diabetes. And so losing those pollinators is actually costing us quite significantly in health terms. Fisheries is another example where we've shown that nearly 1 billion people in the world are relying on wild harvested fisheries for important contributions of nutrients like iron and zinc, but also omega-3 fatty acids, vitamin B12, and that there are 1 billion people who are relying on the fish and are living close to a threshold of nutrient sufficiency. And so those are the people that would be at risk if they can't access those wild harvested fisheries. A final example is work we're doing in Indonesia on biomass burning, and we're showing that using fires to clear land turns out to be putting tens of thousands of people at risk annually for death from cardiorespiratory diseases because of the smoke that's generated by these fires and these haze episodes in Southeast Asia. So really what ties all of those kinds of research together is this inquiry into the human health implications of these changes in the structure or the function of our natural systems, and often these sort of surprising unintended consequences and sort of systemic impacts of just transforming the conditions that we've evolved to live under.
And so what can we do about it? I mean, where does this take us in terms of what do we need to do differently? And I know it's difficult to prioritize, right? But if you must, which interventions would improve planetary health most effectively?
Well, if you think about that sort of arc that I've just described of sort of the increasing scale of human impacts on natural systems, and then the sort of transformation of nature that's leading to these altered core conditions, and you think, well, so how do we address that problem? We really need to go upstream, and we need to think about, so how are we transforming natural systems? And the answer is sort of we need to do everything differently. So pretty much everything that we do, whether it's the way we produce our food, the way we generate our energy, the kinds of cities that we design, and the way we live in urban environments, the way we manufacture products, all of those things together are having this sort of outsized and growing impact on our planet, and our planet can't keep up with it. And so we need to do all of those things differently. The good news is we actually know how to do all of those things differently. And so, right before our eyes, we're starting to see a transformation of our energy systems. We're seeing that somewhere around 2/3 of the world's people now live in places where renewable energy is less expensive than fossil fuel-based energy. And so, that transition is underway. Our food system is also experiencing really rapid transformation, and there are lots of ways that we can be dramatically more efficient in the way we use agricultural inputs, from land and water to agrochemicals to energy, and produce our food much more efficiently. And so really you can go across each one of those domains and you can see a whole variety of ways that we can be much more efficient and have a much lower sort of ecological footprint in how we do what we do. And a lot of that is what we talk about in this book that we have coming out this summer.
Yeah, and we'll talk about the book in a bit. What have we learned from the coronavirus, from the COVID-19 pandemic?
Well, I think we've learned a lot, actually. I mean, it's been an enormously painful experience for everybody, and unfortunately, that pain, I think, is going to continue for some time in terms of both loss of lives and livelihoods. But I think it's taught us a lot. It's really a planetary health problem. The first thing that we've learned is that it's sort of the latest in a series of alarm bells that have been kind of ringing from the planet over the last, several years, from the extraordinary hurricane season in the Caribbean a couple of years ago that just devastated Caribbean nations, to the fires that then started right after that in California, and then we've seen them in Siberia and the Amazon, and now a lot of Australia has been on fire, to the droughts and the famine in the Sahel related to climate change, to the worst locust plague in 70 years in East Africa that's going on right now. And so we're seeing these sort of postcards from the planet, these messages that we are engaged in an inherently very risky relationship with nature. And I think the COVID-19 pandemic is the latest of those postcards, and maybe the most extreme, that's fundamentally pointing out that our relationship with wildlife is very risky. And we've been warning about the likelihood of a pandemic coming from that relationship for decades. And here it is. I think another thing we're seeing is that science really matters, that nations that paid attention to the scientific warnings a long time ago and built good surveillance systems and testing capacity have fared much better than nations that have dismissed the science or cast doubt on the science, and that lives have been lost as a result. We've learned that nature brings solace to people. We're finding that all over the world, what's helping people with their mental health and their sense of community is going out and coming together in our parks and protected areas. And we're learning the true value of having access to nature at this time of extraordinary stress. I think on a more positive note, we're learning that collective action and behavior change is possible on just an extraordinarily rapid and global scale, which none of us would have anticipated a few months ago, and is highly relevant to the kinds of behavior change and collective action that are going to be necessary to really get us on the right track in terms of planetary health. And the last thing, and I guess as part of that, we're also saying that seeing that people are capable of a kind of altruism that is very, very hopeful, that people come together and they help each other and they reach out. And certainly we need that. And finally, I think we're seeing really an extraordinary opportunity as painful as this moment is, because governments around the world are starting to appropriate, stimulus packages as well as assistance packages for the worst hit countries. And both of those spending opportunities of trillions of dollars of our tax money are opportunities to invest in a much brighter, more stable future, and to build the kind of infrastructure that we need to get on a different trajectory that's much more consistent with planetary health.
Yeah, and so during this time, are there interesting examples of regeneration that you've seen that could perhaps serve as an example of or inspiration to some of our listeners?
Well, I mean, I think there are examples all over the place. And as I said, I mean, one example that we're seeing is just this capacity for behavior change and altruism, which is, I think, really encouraging. We're seeing that, some natural systems are pretty resilient, that, suddenly air quality is improving all over the world in very dramatic fashion. But we've also been seeing for years these signs of potential, whether it's the, extraordinary sort of wastewater treatment project in Santiago del Chile called Aguas Andinas, that's basically turning all the sewage for the major city in Chile into energy, clean water, and fertilizers with a zero carbon, footprint, or efforts within the food system around precision agriculture and robotics and AI to actually really dramatically reduce inputs for agriculture, or efforts around the world to reduce food waste with creative apps like the Too Good To Go app in Europe, and there are others around the world to sort of connect consumers with retailers and reduce food waste dramatically, which is needed. To innovations like Beyond Meat or Impossible Burger, where we're actually seeing tens of millions of burgers being replaced, beef burgers being replaced with vegetable-based food. So to even the sort of resurgence in thinking about indigenous knowledge and faith-based traditions and humanitarian traditions for looking to values that are more consistent with a more nurturing relationship to our natural system. So really, everywhere you turn, you can find examples that are hopeful. And it's really, how do we stitch those together and fertilize them and catalyze them and make them the norm instead of the exception?
Right. And so finally, are you optimistic or are you pessimistic? You probably get this question a lot about the something you call the urgency of now, the fact that really action needs to be. When we chatted before, you said that what happens in the next decade is key.
Yeah, I mean, I never know what to do with that question. To me, whether you're optimistic and or pessimistic is like being asked to look into a crystal ball and see the future, and I don't have a crystal ball. What I can say is that I'm hopeful. But at the end of the day, whether things are going, whether this will be the pivotal moment in human history where we start to turn the tide on the sort of scale of our ecological footprint and transition to a way of living in more balance with our natural systems, and build a much more hopeful future for future generations of humans as well as the other species on the planet. That all depends on what we do right now. And so it's not, we're not passive sort of observers of this drama that's unfolding. We are actors in this drama, and it depends what we choose to do as individuals, as communities, as states, as countries, as a global community, what policies we support, what products we buy, what companies we start, what kind of social movements we build. And so all of that is going to be needed. And, this is the great, sort of drama of this moment, whether we can turn this around. And I'm hopeful because I see evidence like we're seeing right now of altruism and effective collective action. And there are times where I think, no matter what we do, there will have still been a lot of suffering as a result of our transformation of natural systems that can't be undone. So, it's tempered hope, but I think there's reason to believe that we can do this. We know the solution. So it's really a question of whether we have the will to really make that transformation take place.
Yeah, no, very wise words indeed. So I'll perhaps summarize a little bit some of the points that you've made. And in the meantime, I encourage everyone to submit questions in the questions box on your screen. And my colleague Ramona is going to put them in a slide deck, and I'll read them out, and we'll have another 20 minutes for Q&A. So what I hear you saying, Sam, is perhaps can be summarized maybe in 3 points. First of all, that how we manage our planet is about our urgent self-interest. So it really is about preserving our own health as much as the planetary health, and there's a strong connection there. So if we really need to take this very seriously. At the same time, we see enormous opportunities to address the problems, as you mentioned. There's a ton we can do, and these are actions are good not only for the planet, but for all of us, and their health co-benefits for any action, climate action, well, not only climate action. You've been clear to point out this goes beyond climate change for sure. And then that there's a value component to this as well, right? We need to come back to our values: respect for nature, for our place in the natural world, for social justice and equity. So with those 3 points in mind, let me take a look at some of the questions that we have. And we have a ton here. Okay, great. So do you think that industries and big companies are ready to help us? It seems that changing the way to produce means less money for them.
Well, I mean, I think that we'll see. The example that I gave of Aguas Andinas in Chile is a private company based in Barcelona.
Yeah.
In the late 90s, 97% of the sewage in the largest city in Chile was unprocessed and just being dumped into the river. They created these biofactories, not out of altruism and not with an interest in losing money, but they invested in these biofactories, and ultimately now 100% of the sewage in Chile is being treated. And not only is it being treated, but these facilities often take 15 or 20% of the energy budget of an entire city. They're enormously energy intensive. But by actually capturing gas and burning that gas, they're generating as much energy as they're using, so they've become carbon neutral. There's the in-stream flows in the river below the city have picked up, and the water quality is dramatically better. And now they're creating parks that people are coming to, and local farmers have access to fertilizers and better water. The aquatic life is coming back in the rivers. So there's all this positivity, but there's also something like a 20% profit line for this company. And so it's not necessarily choosing to take a financial hit. Beyond Meat and Impossible Burger that I mentioned have been enormous successes. Something like the Too Good to Go food app is a way of finding an inefficiency in the market, right? And in fact, retailers are now able to sell things they used to throw out, and consumers are able to buy things that used to be more expensive. And so everybody is winning in that situation. Now, in general, the idea of circular economy and producing products with less waste makes sense and should be less expensive if we can get there. But I'm not so naive as to think that all of this is going to be done with sort of win-win-win solutions. And so clearly there needs to be a regulatory environment that supports businesses doing the right thing, and that needs to come from governments. And so I think as citizens, we need to be pushing on our governments. We need to be coming together collectively to say, there need to be some rules about how much you can pollute and how much waste there can be and efficiency levels, and are you allowed to throw out this much food, and those kinds of things are happening. And so as those pressures change, the externalities associated with how we do our businesses change, and the risks associated with those externalities change, and suddenly a business model that isn't taking those into account is actually just a bad business model. So I think it's more complicated than just saying, should businesses be willing to take a hit to do the right thing? I think we need to construct our societies so that they're not taking a hit to do the right thing. And in fact, it's just the opposite.
Yeah. And then we have to have civic involvement and get the vote out, so forth.
That's right.
Do you see UN SDGs as the way forward for delivering planetary health? If not, then why not?
Well, I think the Sustainable Development Goals are a really important sort of benchmark for kind of a global target of where we're trying to go as a global society. And I don't think it's a question of whether they're, the right or the wrong benchmark. They're clearly, there's 17 major goals. They target, everything from biodiversity loss and the health of our oceans and the climate system to, nutrition and hunger and poverty, and they're pretty comprehensive. But what I do think is that the planetary health frame is actually an extremely useful frame for viewing the Sustainable Development Goals. When they first came out, people were looking at these sort of 17 disparate goals and kind of wondering, like, this seems like sort of a strange collection across, environmental domains and development domains and health domains. But when you look at them through the lens of planetary health, they suddenly kind of come into focus as all being part of a whole, and they make a lot more sense. And so, in fact, I think that the SDGs, as they're currently constructed, are very consistent with a planetary health perspective.
Excellent. And so here's another question. Would you think the power of change is with the consumer, the private sector, or do you believe that governments have to lead the way to the right regulation? So I think you touched on this a little bit. And if you want to comment that quickly, sure, go ahead.
Well, I think the answer is yes. It's the consumer and the private sector and the government. We all need to be doing everything differently. So consumers need to be putting pressure on their governments and on the private sector around what kind of food they want to eat, what kind of products that they want to buy. They need to be starting to reject this sort of narrative that pipes into our phones and computers and homes 24 hours a day, that what makes us happy is acquiring more stuff, which we actually know isn't true from our social science research, but people tend to believe anyway, and that what actually makes us happy is being with the people we love and being connected to something bigger than ourselves and taking care of the places that we love. We need
clean air.
The private sector to take initiative as well, and we need a government regulatory environment that enables the private sector to do the right thing. So it's a combination, but I think there's a huge role for a globally activated citizenry, because I think the pressures on government and the private sector have to come from an activated citizenry. Until we all demand that things look a little bit different, then there's no incentive for the government or the private sector to really change what they're doing.
Yeah. Here's another question. How do we catalyze a shift from business as usual thinking at government level towards equitable recovery for people and the planet? And this is at government level. So this is someone who's thinking how we influence government thinking.
Yeah, I think it's a good question. It's hard to speak in generic terms about government, especially in a conversation that already involves several different regions of the world. When I think about government, I'm in the city of Cambridge, I'm in the state of Massachusetts, I'm in the country of the United States. Each one of those places has completely different governments of different sort of functional levels. And then you get to, the UN system and multilateral government. So I think some of our governments, cities are doing a wonderful job taking leadership around planetary health all over the world and linking together and sharing lessons. And, you have cities from, Copenhagen to Curitiba, across the board that are really paving the way. Some of our national governments aren't doing such a good job. But again, I mean, I think it comes down to an activated citizenry. Governments reflect what their citizens demand of them. And if citizens come together, particularly in collaboration, and say, you know what, you can't spend these trillions of dollars of stimulus money on shoring up an old broken system that's choking the life out of our planet. You need to spend that stimulus money on a transition to a healthier way of being in the world for people and for all other species. And if they come together and demand that in, the numbers that are needed, then governments will listen. So and so too with equity and social justice. I mean, that has to be a demand coming from the people that can't be ignored by governments. Government. This is how social change has always happened. The people need to demand it first.
Yeah, it's true. We have another question here, a couple of questions that relate to the coronavirus. One is, what are some key actionable and feasible changes towards a sustainable future that could result from COVID-19? And also, what lessons will we learn from this pandemic and what abilities we must build to make sure no new pandemics hit us? Those are slightly two different questions.
Yeah, I mean, I think in terms of what are the actionable items coming out of the pandemic, I think we're seeing already that we can change our behavior in really dramatic ways. We're having this meeting virtually. I think we'll have more and more meetings virtually, and in part to lower the carbon footprint of people coming together. Cities around the world are building bike lanes. There's a front page story this morning about how it's nearly impossible to buy a bicycle because so many people are buying bicycles, which is wonderful. Boston, where I live, is busy constructing new bike lanes, in part in response to this pandemic, because public transportation is more worrisome to people. But if this becomes a stimulus for bike-friendly cities, that's a huge health co-benefit of people getting exercise, and a huge benefit to our climate system and our air quality. So, I think, as I said, the stimulus packages that are coming out, we need to be employing people. We're about to see this huge increase in unemployed people. And how about employing those people towards building green infrastructure around the world? And those conversations obviously are happening at very high levels right now. So this isn't my idea. This is, the Club of Rome has been having a meeting about this. All kinds of groups around the world are really thinking about how to use these stimulus packages as part of building green infrastructure. So I think there's a lot actually that could come out of this moment that's positive in terms of what we call the Great Transition. In terms of lessons learned about what to do differently, I think there are a bunch. One is we need to take the idea of surveillance systems and testing capacity and protective medical equipment much, much more seriously in places like the United States. And there's some countries that have done a terrific job, particularly countries in Asia that experienced the SARS pandemic and really learned a lesson from that and built the public health infrastructure to respond to the next one. We need to do something like that. But we also need to change the way we interact with wildlife. And it's the live animal markets, but it's also the live animal trade, it's bushmeat hunting, which is depopulating a lot of the world's forests, but also exposing people to zoonotic infectious disease. It's incursions into wildlife habitat through agriculture and logging and other kinds of extractive industries. So there's a whole series of ways that we interact with wildlife in the natural environment that are very risky fundamentally, and that we could reconfigure to be in better harmony with wildlife and with nature, less cruel to animals, more consistent with protecting biodiversity, but also better for our own safety and health.
We have another question here. How can the healthcare sector become more sustainable while maintaining or increasing its resilience against stressors and delivering benefits to human health? That's an interesting question.
Yeah, and I mean, it's a great question. It's not something that I'm expert on. There are definitely lots of groups, Healthcare Without Harm, and many others that are focused on sort of greening the hospital industry, on addressing the issues of waste, of plastics, the energy consumption. Clearly, building new hospitals where all the electrical equipment is in the basement for, cities like Boston, which are essentially at sea level. That doesn't improve our resilience to extreme weather or sea level rise. So there are building design issues, there are energy consumption issues, there are waste issues. And I think those are really important to think through. I also think that it's not just that. I think that our clinicians represent just this enormous global workforce that essentially touch nearly every single human being on the planet, whether it's traditional healers or physicians or nurses or mental health workers, and that they can serve an educational function, beyond the physical plant of the healthcare system, to help people understand that how we interact with our natural systems is a matter of self-interest, and that there are certain things that we can do on an individual basis that are good for our own health, but are also really good for planetary health, like eating more vegetable-based diets, use walking or biking to work, insisting that our energy sources are clean energy sources. Those are things that are good for us, but they're also good for future generations and for the rest of the planet. And we actually have launched this whole Clinicians for Planetary Health initiative out of the Planetary Health Alliance that's really focused on trying to bring together that community of clinicians to help spread that message and educate people.
This is slightly related to that. Someone's asking, could you briefly comment on the differences and similarities between global health and planetary health? What is at the stake in the shift from the former to the latter, if there is a shift at all? And then this person references two sources here.
Yeah, thank you for that question. I think there's sometimes confusion about that. And I think that planetary health, when it emerged in 2015, never had any interest as a field in replacing or eclipsing in any way the field of global health. I think they're two very different things. And the way I conceive of it, planetary health is nested under the umbrella of global health. So global health is a perspective that is focused on the health of all people everywhere. It has an emphasis on equity, on access to care, and it's also very comprehensive. Planetary health is specifically focused on the human health impacts of global environmental change. And so it's not focused on trying to do smoking cessation campaigns or seatbelt laws or, a myriad of interventions, improve vehicle safety and reduce accidents on the roads, that are incredibly important from a public health, global health standpoint. But planetary health is focused on a particular subset of the issues that relate to global environmental change. The premise of planetary health is that over the next several decades, those kinds of large-scale environmental changes are actually going to be driving a majority of the global burden of disease. So our transformation of nature is driving an ever increasing sort of cost in human health terms. And so I think the share of global health sort of burden of disease that is being driven by these environmental changes is going to keep rising, but it's still a subset of the larger kind of global health conversation, and very consistent with the global health perspective.
Yeah, we have a gentleman here who's asking. He's calling in from a developing country, and he's asking if there's a call to action amongst national leaders, if we can come up with one to engage in the planetary health framework lens perspectives as they try to reboot the complex energy systems of energy, food resources, and transportation, among others. And this is a little bit what you referenced before, where you have a lot of funding coming in now, and how to make sure that that is funneled into what you call the great transition sometimes.
Yeah, I mean, I would really love to see that. It's not something that we have yet sort of taken on, this idea of bringing together national leaders around the world for a particular call. We are actually starting to think about some sort of a declaration at the next annual meeting, the sort of Planetary Health Annual Meeting, which will take place in Sao Paulo in Brazil, either virtually or in person. We're not quite sure yet, but that will be a year from now in April of 2021. And we've started to think about sort of a planetary health sort of Sao Paulo declaration, and it would be very interesting to think about whether bringing national leaders in support of such a declaration, or whether there's sort of a different thing that that we would do with national governmental leadership. But it's a really interesting idea, and we should explore it.
Yeah, well, on that note, let's ponder the call for action. Thank you so much to this lovely chat. If people feel that there's a particular issue, a particular angle that they would like to increase detail on, then we can send in your comments, and we'd be happy to consider doing another webinar. I think, Ramona, if you show us the PowerPoint, I wanted to also tell people about a couple of other Climate Chatter webinars coming up. One is on climate protection projects. Are they a solution to global policy inaction? That was one of the questions today. What happens if the governments don't take enough action? Well, here, maybe we need climate protection projects. We have another event in the APAC region, for those of you calling in from the Asia Pacific region, on carbon pricing and carbon credits on the 27th of May. And we have a webinar on building resilient supply chains. That's very much part of this discussion we just had with Sam. And then we have on Planetary Health Alliance's website, you can sign up for their newsletter. I'm an avid reader of that. It's very interesting. And there's also a community on Hilo, and there's a book coming out. Sam, do you want to say a little bit about this book coming out?
Well, much of what we've been talking about has been the focus of a book that I've been editing with my friend Howie Frumkin, and we've been working on for the last 2 years. We just finished an afterword on the COVID-19 pandemic to sort of put it in a planetary health context. But the book really follows the arc that I described of exploring how human activity is currently transforming our natural systems, what the impacts of those transformations are across each dimension of human health, with chapters on nutrition, infectious disease, et cetera. And then sort of turns to really focus on solutions and looks at energy systems, food systems, the built environment, business, economic theory and businesses, chemical manufacturing, and ends with a sort of view of an aspirational future. You know, what could the world look like in 50 to 100 years if we started to stitch together these kinds of solutions, and what would a really positive vision of the future look like? So that will be coming out in August, yeah, I encourage everyone to take a look.
I'm guessing you'll be able to buy it as a virtual book as well, right?
You will. It will be downloadable as an ebook in addition. Yep.
Excellent, excellent. And then finally, of course, We hope that you will follow us online and follow us on Twitter, on LinkedIn, and so forth. So thank you so much, Dr. Sam Myers. It's been a true pleasure to have you with us at Climate Chatter today. Thank you so much.
Thank you. It's been a pleasure for me as well. Bye-bye.
Bye-bye.